All right, so here we are back on section K. And section K, again, the goal is to prevent dehydration and malnutrition. So we're going to assess our swallowing or the resident's swallowing. So again, this is when getting into the dining area and observing and chatting with our clients can really help speed this process up. Imagine that you're responsible for 300 residents in a long-term care facility and you have a quarterly assessment due on all of them. Well, they're all not going to fall at the same time. So this is something that you're going to be doing on a regular basis, asking them about chewing, swallowing problems, observing them. We're going to record their height in inches, their weight in pounds, and then we're going to determine if they had 5% or more in the last month or 10% or more in the last 6 months weight loss. So just like in chapter 7 when we looked at that assessment of weight change, the significant or the severe, significant is going to be 5% or more weight loss in the last month, 10% is going to be the severe, 10% in the last 6 months. We're also looking at weight gain. Okay, if the client did not gain any weight, we're going to enter a 0 here. If they did gain weight, we're going to enter a 1, and the 1 means that we want them to gain weight. And if they did gain weight, but they are not on a weight gain regimen, then we're going to enter a 2. And then we're going to check all of the following nutritional approaches. Okay, so while a resident, have they been getting IV feeding? Do they have a feeding tube? Are they on a mechanically altered diet? So the dysphagia, international dysphagia standards. Are they on a therapeutic diet or none of the above? Okay, so you see we have while not a resident. So this would be performed while not a resident and within the last 7 days. So let's say that your client just got there, or that they were your client and then they got sick and went to the hospital and had to come back. Okay, so most of the time our checks are going to be here in the while a resident. But this MDS section K is a very important part of our work as a nutrition professional in a long-term care facility. And again, it is utilized to help with reimbursement, funds of reimbursement. So in most facilities, there is someone whose main job is to go around and make sure that every department is completing the MDS because it is that important. We also have HIPAA, and most of you are familiar with HIPAA just through your own health care. In HIPAA, it's the Health Insurance Portability and Accountability Act. And this is just ensuring that patients' medical information and private information remains private. So you have to adhere to HIPAA. If you are not adhering to HIPAA, it could result in your termination of employment, or as a student, it could result from your termination from the program. So we want to make sure that we're not bringing information from our clients home with us. We want to make sure that we are not talking about clients in public places or talking to our friends about these interesting cases that we've seen at work and telling people's names or describing in detail some characteristics that may make it obvious who we're talking about. And for example, if like a Milwaukee brewer is at Freighter and that's one of our patients that we're reviewing, if you give out information about their knee surgery that's complicated and everybody knows, for instance, that Ryan Braun has this knee surgery, then those characteristics would be breaking HIPAA. So go ahead and read through chapter 9. I also included here a handout on different charting methods, and that is, you can find that in Blackboard. So you have a SOAP example here, okay? And then you also have that a dime